Thanks for sticking around, first of all. And, like a lot of the different things in this program, we had a few changes, so in speakers and topics and everything else, but hopefully we're going to share a couple relevant things with you. One around what we call at IBM client advocacy, and that's really around building advocates out of our clients. And that can take a lot of different forms. And Meredith is the leader in our healthcare group around thought leadership, which is very important for us and probably many of you as well. And that can also take many different forms. So we thought we would just share a little bit about what we do at IBM for developing client advocates and thought leadership and how important that is in the whole funnel of marketing lead generation. So I think because we're a pretty small crowd here and we have a few charts, but we don't even have to go through them. We can make this as interactive as we want. So if you feel like saying, hey, I don't get that, or I got something to add from my company, we could just do that. Are you cool with that? Yeah. Okay. I'm going to start with a video, and I was trying to figure out which one to share with you guys. And I really like this one for a couple reasons. It really shows how we have developed a really strong client advocate in one of our medical clients, and it also is around one of our new AI solutions. I will warn you, it's a little bit long. Obviously we all like to do the consumable content in 30 seconds or less. This one is closer to 3 minutes, but it is, I'm going to tell some stories around it as well, so I think it's worth starting with. So get your popcorn out and we'll watch a little video to start.
A good story's got staying power. A good story carries things forward. Human beings are narrative-driven creatures, and the narrative is very important. That narrative gets lost in this massive information that's in the EHR.
We have information in a variety of places, and that disparity creates challenges for our clinicians. When you're seeing 74,000 patients a year through your emergency room, multiple hundreds of thousands of outpatient visits, it's easy to overlook something.
Our systems are all geared to giving us current information. Today's labs, yesterday's labs. Historic information, stuff that's gone into the medical record sometime in the past, is frequently buried.
What IBM Watson Health has enabled us to do is to incorporate hundreds of thousands of bits of information so that a radiologist can accurately read a patient's image, so that ultimately we can make the proper diagnosis and incorporate the proper treatment to enable our physicians and our caregivers to heal and ultimately save people's lives.
Patient synopsis puts a lot of information that comes from a lot of different sources in the medical record on one screen. Then each part of that screen, you can click on it and expand it. So it's quick to get a really good handle on a lot of different things just with a few clicks.
I think the context that AI brings, and specifically IBM Watson Health patient synopsis brings, is for the most appropriate contextual data from multiple disparate sources to come to a single point of focus for the radiologist.
This product was developed by radiologists for radiologists, so it really works for radiologists. I think the more you use it, the more potential you see for it.
We don't want to rest on our laurels. Evidence-based medicine changes every day, and IBM Watson Health and Patient Synopsis helps us make those changes constantly and continually improving quality of care.
Patient Synopsis brings, more depth, more life. It just makes the story more solid and cohesive. And that's what improves the quality of what we do.
We always think of things as partnerships with our clients. So it's about them, but it's about us. And we actually we didn't co-develop this solution with them, but they got in early, and we kind of formed it with their inputs and their knowledge of their medical facilities and doctors. We do a lot of that with Memorial Sloan Kettering gives us all of their data on certain cancer topics and whatnot. So we're actually, they're our behind the scenes partner, but in this case, they're also our client. So this is an example of client advocacy, and it's extreme because what they do is they do press releases with us, they speak at events with us, they develop all sorts of forms of references, not just this video, but there's written case studies, there's quotes that we have on our website. You can take it in so many different forms. And so I just want to talk a little bit about how we do, how does this happen, or how do we create clients as advocates, and the importance of it. I don't know where I need to be. Okay, so like everything, and you don't have to look at this eye chart. I only have one simple point on this, which is that these are two very important elements in the funnel of all of the activities that we do for marketing. So this is somewhat of a simplified version of how we plan our campaigns. And so we've got a lot of stuff that will drive them to different things. And thought leadership, which Meredith is going to talk about, not just in blogs, but thought leadership assets in general and thinking in general. And then the client references. We won't do anything around thought leadership or client advocacy, develop any assets unless it is part of something, either a campaign or a solution that we're going to launch. That's, well, in client advocacy, we wouldn't do solutions that are going to launch because we wouldn't have any clients. But in Meredith's case, she's priming the market for some of those solutions. So my point is that we wouldn't do anything, even if it was a great story, if it didn't fit into something bigger that we were doing, whether it be a campaign, a new solution launch, or some other type of priority across the organization. And this, again, is just a visual to say that even though we're doing all that to get the sale, once we get the sale, we want to continue to do it as well. And so, we won't stop thought leadership once we close the deal. We're going to continue to develop it and become thought leaders on different things or in different ways throughout the journey of that customer life cycle. So how do we do it? How do we identify clients that are willing to do this with us? And we have, just in magnitude, right? IBM, we have hundreds of thousands and thousands of clients across the organization. In Watson Health, we even have probably 1,000 clients. So how do you identify the ones who are going to tell the right stories and be good advocates? And there's a lot of ways that we look at this. One of them, important one, is NPS scores. So who's really saying that we're doing a great job right now? Or has said that we've been doing a great job for a period of time from when we implemented it onward, so that we know that they're not happy at a point in time, but they are in general happy throughout the journey. And then we will reach out to we have, what does the CSM stand for? Client Service Manager, yes. Something like that. Yeah, they're in charge of making sure the client's happy, but then we also have a whole team of sellers too. So reaching out to the point people who are responsible for the client who has great NPS scores is one great way to do it. Obviously, they have to have a story to tell. So you sell something, you don't have a story. We have to wait for there to be results. We always want to have results to share in our stories. So once we work with the sellers and know that they have good results and we're upselling or cross-selling or doing other things with them, that's a good time to be engaging as well. So identification is probably one of our biggest challenges because of our size, and we as marketers are not aware of all the stuff that's going on in the field. We're not looking at every pipeline deal that comes in because we simply can't afford to do that. So we have to rely on our internal collaboration and really working with the sellers, who are sometimes difficult because they've got to meet their numbers, right? So you have to sell the sellers on why this is a good idea. And at the end of the day, they all want this to sell more of whatever they're responsible for selling, but they don't want to have to go through the effort of doing it on their own because it's hard. It's hard to ask your client to do it. It's hard to do the follow-up. So my team makes it as easy as physically possible for both the client and the seller to do this. They do all the work, they do all the writing, they basically just ask for approvals. So they hear the stories, and then they develop the content, and then they go for approvals, and there's all sorts of steps in between. Yeah? No, please. Yeah. Yeah, actually the hospitals are better than some of the constituents that we call on. Governments are hard because we do a lot with the governments. And so you really, in this case, he talked a lot about us. But in a lot of cases, sometimes they don't even really mention IBM or the IBM solutions. So in reality, you're getting a whole lot of free marketing, right? You're getting all these deliverables that talk about your success as a hospital, and they can, go do whatever they want with that. And IBM's kind of a brand that people want, so that helps for sure. Yeah. But yeah, some are tougher than others, and the team is just like adamant. And what's really frustrating is you can get like so far down the road, and then somebody from the client's legal team says, not doing it, or the person leaves, or the seller says the deal went bad, or there's like all these. There's more reasons to not do something, no matter how far along it is, than there are reasons to do it. So our job is a lot of convincing and selling. Yeah. Engaging, again, so we got to engage, we as a team have to engage the right people, convince them to get it done, and then arm them to go in with all the right messages and materials, just like you would if they were selling a new solution or something to their client, because in essence, it kind of is a sale. It's not a monetary sale, but actually for the client, they get a monetary amount of stuff done for them. So we have a whole welcome kit, and we have a whole bunch of processes and approaches to talk to the client. Of course, everyone's different and everyone does it differently. We prefer to do it with a client if the seller will let us, because we know we'll do it right. And this we would have to teach the sellers how to do it, because some of them will just go in there, hey, will you be a client reference for us? Partner is really just, once we secure that, partnering with them to tell the right story. Because again, we are not the ones in there implementing or telling or knowing the story. So we really have to extract all the right things from the client to tell the most compelling story that we can with results to the extent that we can. And so that's really a partnership with the client. And then our job also is to amplify it, to get it into those campaigns, to get it into blogs, to get it into a lot of different marketing activities, and to have the sellers use it, most importantly, to sell more of that solution, or even other solutions, because they think that would help their sale. So these are just, I put some examples of how we can use these case studies, and references. We try and always do a formal case study, like a 2-pager on the story itself that will lead to our web site, where that resides in a digital format. We've actually gotten away from doing PDFs. I think everything now is digital, so they all have their own URLs. You already saw the testimonial video. Meredith will talk about her thought leadership, but when there's a really good client story, she uses it in the blog, and she writes a whole blog about it. And our blog is called Perspectives. It's on the IBM property if you guys want to see it. We do webinars, events, all sorts of things. This is just like a sampling. We try and do as much as we can once we get a good client and a good client story. And then this is just, the whole impetus of us doing all of this work is it helps in our NPS scores, hopefully. It helps with our client relationships when we do this story with them. We see that it strengthens it. The relationships with those who we are, they are realizing, yeah, this is a great story, and IBM wants to tell this with us, and so they get excited about it. It's a hard thing to measure, just like thought leadership is, but the idea is to use it to sell more. That's why we're doing the whole thing. And then having a marketing impact in our campaigns, and really, I think the campaigns that can use thought leadership and client advocacy materials are stronger. So I think that's it for me.
Right. So this isn't on. Is it? Yeah. Can you hear me okay? Okay. So transition slide here. So I do manage thought leadership. I've been with Watson Health for about a year. And Lisa is my manager. I'm very fortunate in that. But one of the things that I think is important to note about thought leadership is that it's not separate from the customer journey. It really should inform and engage customers all throughout that process. I'm showing a slide here actually from our friends from Edelman. So it's a study they've done the last couple of years I've seen, and this was released in November. Yeah,
She's like,
you guys know, right?
Seen that one.
Yeah, you've seen it, and so hopefully I'm representing this accurately. But I love it. I love what you've done, and I highly encourage everybody to go check it out because
She uses it all the time.
I do. Well, I think it's such a great look at thought leadership, and it has a lot of really it can really inform how you approach it. But one of the things I wanted to pull up for this particular talk was the customer journey. It's not just about that. I think people think of it as like a discover piece of content or that care that really early in the journey because you're not selling something. But B2B decision makers in this study say that, yeah, it does actually affect their decision all throughout the relationship with their company. So, not just early in the consideration or purchase stages, but also the upsell and the cross-sell, that thought leadership does play a role in that. So it's just something to keep in mind throughout.
I'll click for you.
Oh, thank you. So how do you measure thought leadership? This is a challenge. This is a really hard thing because you're not really driving leads with it. You're not really measuring, how many dollars change hands. And yet it does have to, at the end of the day, when the company's investing in thought leadership, it does have to, in fact, help the company sell. So we have broken it down into sort of three main areas where if you were to ask what Watson Health's thought leadership strategy is, it's to have compelling, consistent, credible content that strengthens the brand and conditions the market. It's pretty simple. And then from there, we try and amplify our position. If you look at the strengthen the brand, we measure that in a few different ways. So we're trying to establish our point of view on topics that align with our narrative, align with our brand, something that makes sense for us. So we try and articulate our position with our subject matter experts. So I've only been there a year, and I have to say I'm constantly wowed by the people that work at Watson Health. There are some really brilliant minds, some great clinicians. It makes my job really interesting and makes it great to get out there to articulate our position with them. A lot of times it's on the blog. I think the blog is a vehicle that really lends itself to that really well as one of our own channels. What we know from our research within IBM content is that engagement with those pieces tends to be about 13%. That tends to be the engagement rate with thought leadership at IBM. We're trying to exceed that, and I'm happy to say that our early signs are good. We've had stuff in place for about a year, and we're exceeding that in most cases. So that is one way we measure it. As far as conditioning the market goes, we really try and align and support our campaigns. Lisa mentioned this earlier, but I meet regularly with we have 6 different segments that we try and support that are working with insurers, with pharma companies, with hospitals. We really try and make sure that we're telling that cross Watson Health story, but we're providing the thought leadership that's going to condition the market for those offerings and those segments. The last one is amplifying our position. So that's when we try and engage audiences through all the normal channels, social events. We know from our social measurement that thought leadership is the most popular type of content that we promote on our social channels. So that engagement is a good sign. We also know that the other thing that we've started doing too is we have partnered with industry analysts to create custom content, custom thought leadership content. That's something that's early on in our journey, but we've found that has been pretty engaging content. We've released a few things in Q4 that really got some good engagement with our audiences. So we can move on.
Okay.
So I wanted to share just one example, and this is one of those examples that I'm sharing only because I had visibility to it, which I don't always have visibility to what happens to something once we release it, once we put it out there, but this particular case we did, and I just wanted to share it, that we have some early signs of engagement. So we had some new research. We had one of our partners is the American Telemedicine Association. We partner with a lot of different industry associations. This is one of them. We, by the way, do not sell anything telehealth. We do not have telehealth, but one of our areas of interest in our portfolio is we help hospitals manage their performance. So performance management is something that we're very interested in saying, we can help you do that. We partnered with them to show a link between hospital performance, and we found that high hospital performance is linked with telehealth use. So those two, and we had this really in-depth, rigorous academic study. So we created a blog, and we partnered with them, and with the president of the ATA, released it on our blog. And then first thing we found is it really got good engagement on social. We found that people were picking it up, not only on our channel was people are engaging with it, they were sharing it on their own and adding their own commentary. So we knew we had kind of struck a chord when that started happening. And then Becker's picked it up. So they reran it, linked back to our blog. It was something that was, again, another sign of encouragement that the industry is looking at our points of view that we're publishing and sharing it, which is good. And then this one is kind of the money shot and the thing that you never see. So we had a sales, we do promote it with our sales teams. We do promote all of our thought leadership. We send it out in a weekly newsletter. One of our sellers said, hey, and this is real. He sent it along to a customer and said, hey, I don't know if you saw this. This just came out on our blog. And the customer responded with, the first word on it is, wow, like this is exactly what we're looking for. I want you to tell me more. Can you come out and tell us more? So this is just, one example again of how we can engage our clients throughout that process. The advocacy doesn't stop with just a client story or whatever. Thought leadership is one of the tools you can use to continue to engage them. And I would be remiss if I didn't at least mention our event presence. Events is, the folks you saw in the video in the top of the talk here, they also have done some events for us. They were at a panel at one of the large trade shows that we did. I think they were scheduled to be at something else, but really making sure that and as Lisa mentioned, I think in the last talk, IBM Watson Health has to be over 100 events in the year. So it's really, to have a good thought leadership presence, you have to identify just those key events where you can really make a dent, really make a difference, and then make sure that you're surrounding content leading up to it, conditioning people for that, as well as capturing what happens at that event and sharing those insights out afterwards.